Good afternoon, everyone. Thank you for joining us. Today is the third in our series of three for our education series. We're very lucky. We're joined by Dr. Bavette Miller with us today. She is with the OSU School of Healthcare Administration. Prior to putting this series together, we did seek feedback from some of our hospital CEOs regarding topics and things that folks would feel their board members would like to hear. And this was one of the topics that came up. As I mentioned, this is the third out of three. If you have topics, we're always looking for topics. So if there are things that you're like, hey, this is something else we need, or here's another topic for this series, please let us know. We want to be a resource and we want to be helpful. We have a very light live audience today. So if you have any questions, please feel free to put it in the chat or um, just come off mute. And also, if you're watching this recording, if you have any questions or concerns, please feel free to reach out to me. With that said, Dr. Miller, I will turn it over to you.
Okay, thank you so much, Laura, for the invite. It is an honor to be here with you all today. And I'd also like to thank up ahead Jonathan and Corey for their in-depth definitions of the critical access hospitals. I'm not going to go into the in-depth part because that was more related to theirs. But just as we go through this process, I'm going to remind you that for those of you who may be new, this is an alternative reimbursement model that's cost-based reimbursement to protect rural healthcare due to basically low staff and resources. And so the government's decided, as things were happening in the rural healthcare system, hospitals were closing, et cetera, that there'd be a new option. And this is one that we are happy that is here with us. So with that being said, I want to go ahead and get started. So in overview of what we're going to talk about governance, which would be your board. That's basically what they do. They're responsible for the what, and that'll make a little more sense as we go through the process. Management, responsible for the how. And then I'm going to talk about leadership in general. Just it's important for everyone, whether they're in governance or management. We're going to talk about the ins and outs of leadership and some of those things that we may not think about as being a leader and an effective leader, but those will come up. So in our smaller communities, knowing the difference between management and governance and the duties of each can be very challenging because we have such a small number of people able to fulfill those roles in those rural communities. It may be challenging for us to find individuals to fulfill those roles. It's extremely important for us to keep those roles separate. So role clarity and responsibilities of the board is an integral part of a properly functioning board. And we're going to talk about that today, the differences between the two and kind of where that lies. So governance leads an organization. What are our priorities? What's our vision? The board creates that vision, and it's the entity that guides. Management, on the other hand, so your CEO and those that work within the organization, they run the organization. So how will we get there? How will we reach our goals? So they implement the vision, and they're the one who actually goes. So they're the one who does. So these two, although they are very separate and should remain so, they should remain divided, they should have effective and productive relationship. There's mutual respect for separate but there should be mutual respect for separate but interdependent roles. And so a clear definition of results to be achieved should be present for all involved. And then clearly defining and documenting the delegation and duties within the organization and within the board is also very important. Knowing the authority that is there for the board members and then how that relates to the organization should be known. And then boundaries of freedom and influence. So realizing that we have freedom to think and express ourselves, yet we also have the influential power to make, maybe make decisions that mostly have to be ethical and legal. And so ethical, fair, and transparent processes for the CEO evaluation is also very important within this. And so we'll talk about all these things as we go through. So board members, if we talk about governance, we're going to start on the governance side. So for the board members, board members are the eyes and the ears of the community it serves. The job is not to run the hospital. And we always have to remember that that is not the job of the board. That is the job of the CEO and the group with the CEO. So job is to learn what is important to serve the community and the organization. So it's finding that balance of what is important for the organization and then finding out what's important for the community. We have to remember that society's safety net is entrusted by the community with assuring health. And so the critical access hospital is that safety net in this situation. So we have, we need to remember that we need open communication, communication where there's free expression. And we need to, I skipped a couple of little bullets here. So I'll say good mix of skills and expertise. We have to have an effective chairperson. So within our board, we need a chairperson who is effective in getting the job done for what, again, the board is there to do, which is to oversee. Our committees need to be specific to our board needs. And we have to have efficient and well-managed meetings. We'll talk about the timeliness and things like that in a little bit later slides as we go through, but it's very important that we stay on topic. We have to have open communication, which is free expression. We have to remember that everyone's here and they should be able to express themselves, and it's not always about 100% agreement. If a board 100% agrees all the time with no dialogue, that is a sure sign that there could be an issue. So sometimes boards will even need consultants to come in. So maybe there's something challenging or unknown to the board, and they may need a special consultant to come in and help them through that process. Maybe even a mediator, hopefully not, but that can be the situation. And then the board has to make sure they have good self-evaluations. So you want to make sure that as a board, you're able to evaluate yourselves within the board, within the board roles, and then how that fits into the organization. So under governance, here are just many of the things that the board is responsible for. There is a separation of power, so you have to remember not to get involved in the daily matters. You typically are only there once a month for a meeting, and so we have to make sure that we're not in the middle of everything going on just because we're a board member. We have to have oversight, checks and balances from 50,000 feet. So again, the job is not to manage, but to have legal and ethical integrity and just overseeing that process. Make and change policy, the benefits that benefits the organization. So you may have quality of care credentialing and program approvals, compliance and audit advice, things that may be out of the norm that the board will be involved in with advising or guiding the CEO and the organization. Strategic planning, you deliver sustainable shareholder value to the community. So make decisions about the mission, vision, and strategies. That's the role of the board. And that's the only thing that's important is the good of that organization. Financial, you may have opportunities where you can see what is in the best interest of the hospital. You will have those opportunities, but you may be liable if failure occurs. And so if it fails, that would be an issue where the board is liable for that. And so you have to look at what's in the best interest of the hospital. You have to have honesty, no conflict of interest. In certain situations, in all situations, you'll have overall approval of the budget. And then in certain situations, there may be really large contracts that you would approve that would go on up to the board instead of being approved at the organizational level. And I can't reiterate this enough. The most important goal is the best interest of the hospital. And so I'll just keep going back to that. And we have to keep that throughout this presentation to know that's what the board's job is to do, is to look out for the hospital. So the board allows managers to develop their own operational strategies while the board focuses on the overall planning. So we're not going to tell them how to do it. We're going to tell them as board members, yes, this is you brought forth this is the strategic plan, this is the vision, you're going to execute this. And so that's the communication. There are limitations, and so the board has to set those limitations. If it has a negative impact on the overall well-being to the community, that may be a limitation. If there's some decision that's made that's not good for the organization, again, that would be a limitation. Appointment to the board benefits the hospital only. So we have to remember as board members, it's not to benefit ourselves. It doesn't give me any kind of incentive. It doesn't benefit my family members or those who may be looking for a job. Positions should not be used in any way to make employment decisions. And again, the only employment decision the board, pretty much is going to make would be that of the CEO, or the other board members, but you're not going to be involved in the day-to-day. So don't let yourself get bogged down in that, especially in the smaller rural areas to where everyone knows everyone and, it's a phone call. And so as a board member, that is not your responsibility to get, someone hired on to the hospital, uh, to work in the lab. So just make sure that we remember that this is not your role as a board member. Your role is to look out for the good of the organization. Accountability. The board is accountable to the community and outside entities to upholding the duty of their position, especially when unexpected crises arise. And then the CEO is accountable to the board. So the CEO, obviously, and the organization is accountable to the board. The most important duty of the board is the CEO recruitment. And so the board needs to make sure that the CEO is fulfilling their responsibility to the organization through appointments and performance. And it's an ongoing active process. So they have to stay involved and make sure that that CEO is continuing to do so. Always be looking, always be watching. Strategies can change, people can decide to leave. And so always knowing what's around and what a recruitment option could be for the board. It's always important to keep that on the front burner and always know what's available. And finally, the bylaws for the board. So this is part of the responsibility of the board is to create their bylaws, revise them if needed, amend them. Bylaws include things such as the nomination committees, the job descriptions of the committee members. It's very important that it's clearly explained within that, and the expectations are clear of what each committee member is expected to do, and the time commitment and participation, attendance, kind of the skills, expertise, and diversity that we're looking for within our board. And so this is a very important role. And so it's something that the board just needs to make sure their bylaws are always up to date, and if not, to get them approved as quickly as possible and, functioning as to what is being done. I've seen a lot of boards where their bylaws are just old and they need to be revised and updated. So having the opportunity, and it takes time. So I know that's not something that all the committee members have, the board committee members have, but that being said, getting those approved, getting those in working condition is very important, and it just better explains and discusses what is important and what's required by those members. And so it's easier to recruit when you have a very good set of bylaws. So in governance on the board, we need to find the right people for the board, and in finding to have a diverse group of others. The right people have a diversity in the group of others in the community. And so it can be diversity of expertise, it can be a diversity of traits, interests, or areas served. And remember that finding the right person as we're going through this process, this person is going to be a true public servant. As a board member, that is your job. It's to be a public servant. So all board members have the same mission, and it's finding someone who also has that mission. Next, you need to provide training to those board members that may come in. New members need mentors. So maybe it's the current board members. Maybe it's someone in the community, someone else that may not be on the board, that serves on other boards, but answering questions, concerns, and just providing that ongoing support, because you're giving your time, you've chosen to be a public servant, or that person has, and so it's just someone to come in and, you know, be there for them and mentor them. The board also has to establish the board processes and evaluate the board processes. And I talked earlier, establish focused board meetings, making sure you're staying on topic, limiting the executive committee meetings. And what I read about that is just it's better to go before the whole board and talk about things that you're going to end up talking to the entire board about anyway. So sometimes limiting that smaller group of executive committee meetings, just it gets things in action a little more quickly than, you know, having 2 or 3 meetings to prepare for that bigger meeting. So limiting those and just keeping everybody in the loop on that. And then as a board member, we make a difference in the community. So that's one of the things you're looking for in other board members. So it's just being that person that stands out and makes a difference. A big part of being on a board is the advocacy. So as a board member, we communicate the good. We use our own reputation and networks to advocate for funding, access, and expertise. So we use our social and political capital. And there's so many people who are members of boards, or, you know, especially in a rural community, who are those individuals that the community looks up to, and they do use their social and political capital for this. They expand awareness that will cultivate collaborations and partnerships. They be the face of the hospital. So as a board member, you are the face of the hospital. You tell the story of that hospital. You brag about the hospital. You talk about the incredible care, how that the hospital is a trusted community member. You don't have to serve, but you do. And so there's something to brag about that. You know, I don't have to serve this community. I don't have to serve this hospital, but that's what I choose to do. So you get no personal gain from this experience. And then you share times when maybe that entity took good care of you, or that your family has received great care there. And so it's so important that we remember that we're here to advocate for that entity. Politically, I talked up earlier about using your political capital. If you're going to go down the political road, you focus on specific issues. You don't want to discuss everything, because if it happens that you're someone who brings an issue or a need for funding to someone who can make a difference, like your legislators, etc., you need to be laser focused. If you bring every single thing that we think we need or want to them, they're just going to kind of shut down and not really listen. So step out of your comfort zone, put yourself out there, but you need to communicate a well-informed message, one that's, you know, not you bringing one message and another board member bringing a different message. So it needs to be a truly planned communication. And so remember, advocacy is building strong relationships, and through passionately supporting the hospital, it creates positive influence, and it helps build those relationships with the community and with policyholders and policymakers. So some things that incoming board members need to know, they just need to know that this is big picture governance. They need to know their responsibilities. As we mentioned earlier, we were talking about committee roles, etc., time commitment, dependability, attendance issues, or attendance requirements and expectations. And then they need to know individual officer and director responsibilities. So before getting someone to come in and serve on a committee or in an officer role, they need to know what that looks like. And then board administration, so bylaws and the processes of how things work. So now I'm going to talk a little bit about management, not to confuse the topics at all, but I want you to see the difference. We've talked about governance, we've talked about the boards, we've talked about what that looks like. And now we're going to talk about management. And for the most part, I'm talking about the CEO as it relates to the board structure. And so, but it does include the CEO and all of those individuals in the organization. So your management are those that are in charge of making the decisions, allocating resources, and overseeing the day-to-day operations. So management, they support and implement the goals. That's what they do. So we have these goals that were set forth through the board. They have the goals of the organization, and the management supports that and implements those goals. Handles all administrative work. The management delegates, so they'll find the CFO, the chief operating officer, those at other levels of the organization to delegate to, and so they have to have those around them, surrounding them, that they can work with to get the tasks done. They evaluate what works, what didn't work. Organization recruitment. So they are in charge of recruiting for the entire organization at some level. So they're going to hire, as I mentioned, the C-suite, those in the C-suite, the chief financial officer and the operation officer, and they're going to hire human resources, and they're going to hire those, maybe marketing and public relations. And so they're going to do all of that in order to have a fit for the organization, which will then fit within what the board expects and the vision of that organization. They're going to do the financial budgeting. So they're going to prepare the budgets, which would then be approved by the board, and the financial planning, and how we're going to get there, what we're going to do to make it happen. And while they handle all the administrative work, they also oversee all the administrative processes, and they serve as the liaison between the board and the employees of the organization. So that role is very important because that liaison, the CEO, communicates the board expectations through operational goals and implementation. And that's how it's communicated. They also direct the strategic plan. So they're the ones that says, here it is, we're gonna get this. This is what we're going to accomplish. This is how we're going to do it. This is when, etc. They execute operational functions. They keep the board, so maybe the CEO has to help keep the board out of the daily operations. So no, I will. I'm not able to hire this CFO because you say I should, board member, that kind of thing. So that is the job of the CEO. It's to make sure that that is separate, and it's also the board's job to make sure it's separate. Active member of the community. So they either need to be an active member of the community. They need to become one very quickly. So as a CEO, we often may get them from other communities or other states, outside of where we're at. And if that is the case, then they need to quickly, adjust to that community, participate in local, regional, state, and national organizations, and they have to be a good fit for the organization. And so you have to remember, it is the board's job to hire this CEO in the end. And so this is what we're looking for as board members, is someone that's a good fit. Leadership. I'm going to talk now a little bit about leadership, because as board members, it's extremely important that we're leaders within our rural communities, and we need to know the influences, kind of what it takes to get there. So it's fine to say, oh, they're a leader, but are they really? So we're going to talk a little bit about how to get there. Leadership, leading in the rural community, we have to lead with conviction. We use our emotional intelligence. We earn trust and loyalty of those in the community and within the organization. And then we generate informal power. So when we lead with conviction, we use our personal convictions that suggest to leaders how the world should be. Our personal convictions are closely linked to vision because it conceptualizes our roles. And so as the person on the board who is in charge of that vision, then we need to know what our personal conviction is telling us. It's derived from several sources that are typically instilled at an early age, and it serves as our guiding compass, which again, I think is interesting, because as a board member, we are the guide, we are the guidance, we are kind of the compass. So we have to let our personal convictions lead us. to making some of these decisions. And it provides strength to carry on in bad times. Effective leaders lead with conviction when they consistently incorporate their personal conviction into their decision making. We demonstrate strong moral principles when leaders walk their talk. And so you got to make sure you don't only say it, but that you do what you say. And that's how you lead with your conviction. We keep convictions and we recognize them as personal, not universal, and we have high integrity and ethics. And that's something you'll notice throughout this presentation. We've talked about the high integrity and ethics as a board member, and that's extremely important. The reasons that sometimes leading with our convictions can fall short, it may be that we have an internal conflict. And so opposing pressures, two different things, telling us two different, to go two different ways. We may need to also sacrifice personal goals for the community's good. And sometimes that can be difficult, but we have to remember it's not our personal goal. That's not the reason we are here as a board member. We are here for the community's good and for the good of that organization. So leaders may avoid or not have strong convictions, and that can happen sometimes if they just avoid having, or if they avoid listening to them or having strong convictions, we can fall short, and leading others can struggle. Leaders may focus on personal beliefs rather than communities and not perform to their full potential. Community members view their relationship with the leader as transactional. So often it's just, you do this for me, I'll do this for you. And so that, with that being said, we still have to remember that we focus on our personal beliefs, and that, or not our personal beliefs, but our convictions, and that we don't focus on the personal beliefs in that. Sometimes we may not allow our convictions to be expressed at work, and that can fall short as well. So we need to make sure that we listen to those convictions, regardless if it's in the job or personally at home. Leaders may fail to see opportunity to support their convictions through their work. So maybe they don't see connection there. Leaders may also give up thinking they can make a difference in their role. We see that happen often. And as a community member, board member, we have to know that we make a difference. We make a difference every day by keeping that entity open, by, just being there for those who need what we have to offer as an organization, meaning the board. That's your job. You're in charge of that. And so it's definitely a huge difference in the lives of others and in the community. Often you may have burnout. You may, quote, be retired on the job. And then leaders may over focus on personal goals. And we mentioned that earlier. It's not about what you personally gain, but about what you give to that organization. So sometimes we can misuse or overuse our personal convictions. And as a board member, that can happen, within such a small community realm. It can definitely happen. We see all kinds of individuals that may believe theirs are the only correct ones. And so we have to make sure we don't believe that. We shut off creative input from others when we think we're the only ones that know. And then sometimes viewing your personal convictions as correct by virtue of your leadership role. So I like to think of a minister or a pastor or something in that leadership role, to where they're like, well, my personal conviction has to be right because this is what I do. That's not always the case. And so we have to make sure that we stay open to hearing other individuals. And that's really the most important piece of this. While we're listening to our own personal convictions, we have to know that it can only be about what we think. We have to listen to others. Yet, sometimes we surround ourselves with yes people, and that can be detrimental to the success of the hospital or of the community. Even being overly moralistic, it kind of goes back to, if you think you're better than other people, and that can often say that, hey, I'm better than you. You're less of a moral person, and it can create a blind spot for those of us who are in leadership positions. So another way that we can just be even a more effective leader, a more effective member of the community and of the board, is by using emotional intelligence. Emotional intelligence is a construct that unifies a slate of interpersonal skills. And so we know this about ourselves. We know this is how we react in situations. Using emotional intelligence is something that lets us know, it pretty much says we know ourselves a little deeper. So the most effective leaders have a deeper understanding of their emotions. An emotionally intelligent leader, a community member, board member, even CEO, recognizes personal strengths and weaknesses. Hey, this is what I'm great at. This is what I'm not so good at. Let's find a medium. Let's work together. You bring this strength, I have this strength, and we're not feeling threatened. Those are those who are emotionally intelligent. They see links between feelings and behaviors. They know that when I feel this way, if I feel hurt, if I feel um, something like someone double cross me, then I'm going to be angry. So they see that. They see the link between those feelings and how we act and how others do. They manage impulsive feelings and distress emotions. So if I get angry, I'm not going to blow off the handle and scream at someone. If I have a conflict with someone in the boardroom, we're going to discuss it. We're going to respect each other. We're not going to just, you know, become impulsive and angry. We're attentive to emotional cues, so we know when something is cueing us. We show sensitivity and respect, challenge the bias and intolerance. So if we see something happening that may be biased or intolerant, we would approach that. We would confront it in a respectful and professional way. They collaborate and they share. As I mentioned earlier, it's not all mine. I have strengths, I have weaknesses. Let me have someone that can offset my weaknesses, or maybe I can offset theirs. An open communicator. Open communication is extremely important to keep everyone on the same page and know whose responsibilities lie where, who's in charge of this, what authority is it under. So open communicator for an emotionally intelligent leader definitely communicates often and effectively, handles conflict, difficult people, intense situations very efficiently, very effectively. Community and within board members and that relationship is earning trust and loyalty. So you are a direct and truthful person. It's extremely important in this role because you have so many people who watch, so many people who need to trust you, and we have to earn that trust. When you're willing to make mistakes. So if I make a mistake, I need to admit that. I need to fess up and take the fall for it, and people start trusting you when you do that. You're sincerely interested in the concerns and dreams of others. You show empathy. You're helpful. You follow promises with action. So you don't just make a promise, you actually do it. You do what you say you'll do. You maintain confidences. If someone comes to you confidentially, and it's not something that can legally be an issue, then you keep those confidences. You don't join the rumor mill and talk about that, especially in a rural community. You disclose information ethically and appropriately. There are times that you should disclose information and times you shouldn't. And so knowing that just builds, knowing when to do that, when it's appropriate, when it's not appropriate, that just earns more trust. And then you work in transparent ways. So if we're clear, as a board member within that community, if we're clear and we communicate when we can and we share information as we can, as we're allowed, and when it's appropriate, then it's transparency that people want to see. And it works that way with the CEO. It works that way with the community as a whole. These issues can come up when people are working with people. And so people are naturally suspicious of leaders. People can be naturally suspicious of board members and of CEOs. And so it can reciprocate between that relationship, the CEO and the board member, or it can be with the community and the CEO, or the community with the board. And so just knowing that people have that natural suspicion of leaders, it's important that we build trust. So the greater the distance between the leader and someone who's considered a follower, the more likely there is distrust. So developing trust is vital to effective leadership. Trust is the glue that holds communities and organizations together. And when that trust is there, as I said, it can flourish into a wonderful organization and relationship. Distrust can waste so much time and energy, and it's just very anti-productive to to the goal of what we're setting out to do, which as a board, that's what we need to look for. What is the best interest? And that would be, having a trusting entity and trusting organization. So by earning trust, you earn trust by improving accessibility to yourself. And that doesn't mean, as we talked earlier, it doesn't mean that you're helping people get jobs, et cetera. It's you're improving that accessibility. You can access me through, communication. And I'll be open and I'll be honest as much as I can. Being open and frank and sharing that information, as I mentioned earlier, showing concern for people's well-being. We are here to make a difference in the lives of others. We are here to provide a service to those who struggle to find that service in our area. And so we need to earn that trust, being there for them by not being cold and distant. So people who are cold and distant are trusted the least. And again, we're talking even the inner board member relationships inside the board. They need to be very open and honest and warm relationships. By stepping out of the boardroom, sometimes we have to step out of that boardroom and remember we are, in most cases, a member of that community. We are someone who we have family who may go there, ourselves may go there, our spouse may go there. So that being said, step outside that boardroom, shake hands, meet people, and just be a trusting person that they can inevitably, see as open and eventually being loyal to. That's our goal. So we can foster openness, and trust develops when you feel a person's predictable. So be predictable. Trust builds over time, so it will take time. Trust takes place on both sides of the relationship, as I mentioned earlier, between the CEO, between the board, between the board and the community, and vice versa, all those relationships. And then risk is associated with being open. And we know that as the more open we are, the higher the risk. And so leaders have to cultivate an environment of safety. When you're in a boardroom, in a board meeting, you have to cultivate an environment of safety with your fellow board members. And then leaders must be open to feedback. So as a board member, in whatever role, whatever capacity you're in, you have to be open to feedback from others. We need to also be authentic. And so we must engage stakeholders' hearts and minds. We must be connected. So those individuals must be connected to our hearts and minds. And then we must walk the talk. I mentioned that earlier. Do what you say you're going, or do what you say needs to be done. We have to remember we are public servants here. And so our job is to do what is needed and what's necessary. We must accept our own growth possibilities. We must care about people, show willingness and ability to do what we say we're going to do. And we cannot let transgressions go without acknowledgement. We have to acknowledge them and handle any issues that may arise, but do it in a proper and professional manner. That loyalty that we are looking for is related to trust, and that comes from, as we mentioned earlier, building that trust. So trust is necessary for loyalty, but trust alone is not enough. Trust becomes loyalty when followers experience a leader as supporting their own interests over time, and that is our job. It's to support the interests of the hospital, which in the end supports the interest of those who are employed by the hospital. And it's to support the interests of the community, which that's just a triangle. It all interconnects. And so knowing that we support the interests of that hospital and the community over time, that is what will build the loyalty that we're looking for. Exceptional leaders align the followers' interests, so those in the community, with the organizational goals. And that's what, in the end, we're going to do and wrap it up. And whatever this organizational goal is, that's going to be connected to the community interests. So as board members, we have to remember that's what we're looking for, the full circle. So informal power, this is the final thing we'll talk about today. Informal power comes, and it's very obvious within a board member or a board setting, a board environment. It's the capacity to influence others without resorting to formal authority. And so this, as we mentioned earlier, can be um, such a hiccup for board members and learning how to manage and navigate through this. So getting things done requires more than just rules and reason. It requires relationship knowledge. Informal power is a great thing when it's used correctly. And we'll talk about some of the ways that it can be done and then ways that it's not used correctly. So you have to use this knowledge creatively. Success comes from building and navigating the networks, which these are our informal relationships. And if there's one thing you've heard me talk about through most of this presentation, it's relationship building. So the approach to informal power is you approach it strategically. Be selective about whom you develop a power relationship with, and know the value of prioritizing your efforts. We need to focus on talent and opportunities for relationship development, and do that based on what can make us more efficient and can be reciprocated. So we want to do things for others who can do things for us. Again, not I'll give you a job because I'm on the board. I'm talking true interpersonal economics. Just being there for that person or that entity, because that's what we do. That's how much we trust and how much we trust them and how much loyalty we have to them. So that being said, I wanted to leave you with this final thought on effective leadership as a board member, as a CEO, as someone in the community, or as any role that you may have. In order to be an effective leader, we need to find role models, a person who must live by personal conviction to be successful in his or her field. And we talked about the first part of the leadership presentation. We need to have a better understanding of ourselves using that emotional intelligence piece. We need to conduct a personal inventory of our convictions, reconnect with ourselves, think about where you came from, and use that. I use my story often to influence other individuals, especially in rural Oklahoma. I was raised in a very small town in a very small school, and I go back often and use my story and just talk about your origin, build that trust with people, and trust will lead to that loyalty. Broaden your horizons through outreach, proactively challenge your own perspectives. Be careful not to focus too much on your personal goals. Remember, you do have personal goals and you have goals that you want met, but others may view you as interested only in yourself. So when you're building that trust and the loyalty, make sure they realize that, if I'm serving, my personal goal is being fulfilled through service. And it feels great for me. That's my goal being met. But my goal is to help that organization become better, or to help them strategically be what they're created to be. And so remember not to focus on your personal goals as much as others. Within the community, we know that that's what we're there for. So here's a list of my references that I use. And then, do we have any questions?
Well, thank you, Dr. Miller, for your great presentation. For everyone that's watching the recording, if you have any questions or concerns, please reach out to us. We want to be a resource to folks. And thank you again for your time. Thank you, Dr. Miller.